Hello angels, welcome once again to my channel. This is Evangel. I'm a medical practitioner, a Nigerian trained medical doctor working here in Saudi Arabia. So angels, today I actually want to talk about this menace that is really giving everybody headache, that's really scaring the hell out of everyone. One thing is this: these too shall pass. If you have that in mind, then we'll be able to fight it together. But before you do that, remember you have your own role to play. Stay at home, maintain regular hand wash, use your sanitizer when necessary, keep social distancing. That is about 6 feet from the next person who is closest to you. So right now I'm going to delve into this particular topic. I want to talk about the coronavirus disease 2019, that is COVID-19. Hi angels, thank you so much for stopping by. I love you as always. Mwah. So one thing is this: coronavirus is not something that is very new to mankind. We've had series of epidemics in the past. We've had the SARS, which was around 2002-2003. We've had the MERS disease, which is the Middle East respiratory syndrome. It's also a viral disease. Coronaviruses are a group of viruses. It's a family of viruses that are respiratory viruses. Where they act is more on the respiratory system. And these viruses, they are RNA viruses. We have RNA viruses, we have DNA viruses. These are the protein makeup of these viruses. Now it is called corona because it has some from the structure, it has some projections, some crown-like some projections on the structure that makes it look like a crown. That is why it is called coronavirus, from the word crown. So one thing with this virus is that it is new. That's why it's called novel virus. It is new. It was identified last year, first in China, and nobody knows much about it. Probably that is the reason why we are all facing all we are seeing right now. I'm going to talk about coronavirus from a clinical perspective and also from a public health perspective, because I am practicing, I'm a clinician. I'm practicing in the clinic right now, but I have my public health background because I have my postgraduate studies in public health. So one thing about clinical medicine we all know is that we just treat the the disease that we are actually facing, whatever that comes out of it right now. But for public health, we think of the effects generally, the global effect, the economic effect, the social effects, the mental effects the disease has right now, and the aftermath effects. So right now, for coronavirus, I have already said that it is an RNA virus, and it has these projections that make it look like a crown. That is why it is called corona. And we've had similar cases of coronaviruses in the past: the SARS, which is the severe acute respiratory syndrome, and then we have the MERS disease, which is the Middle East respiratory syndrome. Now we have the COVID-19. I've already said COVID, that is coronavirus disease 2019. That is COVID-19. How is it transmitted? Now it is by droplets. It's an airborne disease and can also be transmitted by contact. How is it transmitted by contact? First of all, if you come in contact with somebody who is infected, or the person coughs onto your hand, or the person shakes you, or the person hugs you, and then these droplets are found around your oral region, definitely you are likely to get it. Now for the droplets, if this person coughs directly on you or coughs close to you, this person definitely will shed thousands of viruses, thousands of droplets that might infect the next person. Another thing is this: if somebody sneezes, if somebody laughs so hard, if somebody kissing and all the rest of them are major ways somebody could transmit this virus. Now when this virus gets to the trachea, the windpipe, Here we have from the mouth, we have two pipes. There we have the esophagus, we have the trachea. The trachea divides into two, and then one divides into two to form the bronchi. The two bronchi, one bronchus, two bronchi. One of the bronchi goes to the left part of the lungs, and the other one goes to another the right part of the lungs. Now the lungs is usually made up of 5 lobes. Within the lungs you have the bronchioles, and within that you have the alveoli. Now if this viral particle just goes into the throat or goes into the trachea, you might have some sort of irritations. That is the flu-like symptoms you're going to be having. Now the thing is this: you have the flu-like parts of the disease or the clinical symptoms, and then you have the pneumonic parts of the clinical symptoms. Once it gets into the respiratory system, it could show up as an upper respiratory tract infection or a lower respiratory tract infection. Most of the victims will definitely recover. Most of the victims will have mild to moderate symptoms, while a few of them will have severe symptoms. Now we are not really concentrating so much on those who will have mild to moderate symptoms. We are really talking about those who will have the severe symptoms, those who will have a pneumonia that may gravitate to acute respiratory distress syndrome, that is ARDS. Now for the mild to moderate symptoms, you may have something like headaches, body aches, fever, cough, or sore throat, runny nose. In some cases you may have vomiting and diarrhea. You may have conjunctivitis, that is inflammation of the eye, of the conjunctiva. Now we are not concentrating on these people because most of them will recover. Most of them will just do some self-care at home and they will be good to go. A lot of them may just boost their immunity by taking lots of vitamin C. A lot of them may just stay healthy and take care of themselves at home. The people we are concentrating on are the people who will go along the way to have pneumonia. Now some of these people who will have pneumonia definitely will recover. At least about 80%, let me not exaggerate, about 80% of people who will get this disease will definitely recover. Right now we're having almost 5% death from the whole from all those who have been confirmed positive, and from the projections it might still increase because the number of new cases are just increasing day by day. I won't even say that doubling, that just spreading. The virus is just spreading like wildfire. So now for those who will have pneumonia, some of them will recover without any significant deficit, without any future problem. The prognosis will still be okay. But the people who are at risk, high risk, are those who are older. Initially it was said 80 years and above, now it's coming down to 60, now it's even coming to 45, 40 years. Those who have already compromised respiratory system, those who with uncontrolled asthma attacks, those with bronchitis, those with emphysema, any form of respiratory disease, any form of respiratory disease in the past. These are people who are at risk. Those who have diabetes, because their immunity definitely will be lowered. Those with hypertension, because any form of respiratory or cardiac issue definitely is at high risk. And that is why you see lots of deaths, because most of the deaths you're going to be seeing or we're going to be recording will come from this percentage of people. Now what happens when the virus goes into the respiratory system? Now it goes into the alveoli, and then because the receptors are located in the lungs, so it will take, it will bind to the receptors and then gain entry into the cells, and within the cells it starts replicating, it starts multiplying. As it's multiplying, the cells will die. I mean, the cell will die, and there will be chains of inflammatory reactions. And these chain of inflammatory reactions are the ones that will make fluid to accumulate within the lungs. Remember, what we are talking about is not even something that will happen over the months or over the years. This can happen within hours to days, especially if there's already a compromised respiratory system. Now you have fluid in the lungs. The fluid you have in the lungs is what is going to lead to the pneumonia. Now, lungs is not really a fluid place. It's for air, for oxygenation. And the alveoli, where these things take place, is just tiny air sacs. Tiny air sacs. It just has the air, and once the cells, once the blood flows through them, they get oxygenated, and then they go back to the system. The deoxygenated blood is coming from the system, going to the lungs, is being oxygenated in the alveoli, and then they're going back to the system, and the cells will have probably a normal function. Now, if there is breach in the oxygenation of these cells, what do you think will happen? The cells will not be well nourished. This thing will go over and over again. You start having consolidation. The lung, instead of expanding, if you breathe in, the lung expands. You breathe out, it goes back to normal. You breathe in, it expands. You breathe out, it goes back to normal. Now, because there is fluid within the lungs, within the respiratory system, within the lungs, you will not be able to do your full respiratory activity or function. Now, apart from the fluid that is within the alveoli, you will not start. The fluid starts going within the lung tissue, within the interstitial space, and making the process more complicated. Remember, anybody who has respiratory problem in the past might have some sort of fluid within the lungs, might have some sort of consolidation. Anybody who has cardiac disease, of course, the lung might be compromised. So if this virus now goes into the lungs, it's making the whole issue more complicated. That is why you see them going through the labored breathing, the confusion, the tiredness, you see them breathing, having so much difficulty in breathing. And from even what people are saying, they feel they're going to die the next minute. Now, those who do not have any prior issue before this pneumonia comes, a lot of them will recover. Because it's a viral pneumonia, a lot of them will recover. But those who have an underlying issue, like I said before, who have maybe diabetes, hypertension, cardiac disease, any form of respiratory problem, chronic respiratory problem, you have bronchitis, emphysema, asthma, are likely to have issues. They are the people who will have more complications. Now, the acute respiratory distress syndrome is when the lung cannot do its function. The person is in acute, which is sudden, respiratory, the respiratory system. Distress, the person is in distress. You will see it all over the person. The person is just trying to breathe, is gasping, but nothing is really coming in as regards to oxygenation. So this is when your doctor will say, if it's your mama or your cousin or your sister or your aunt or your uncle or your father, the doctor will tell you that the person has tired out. It means that they will take over the respiration, the breathing for that person, and that is when the person will be put on a ventilator. Even when the person is put on a ventilator, it is a 50-50 thing. The person might make it and the person might not make it. Even if the underlying issue is going to be okay, remember the ventilator itself has its own problems. There are some complications from the ventilator. There could be an infection. There could be a pneumothorax, which is air leaking out of the lungs and going into the thoracic space. So there are so many things that could come out of this. It looks scary. It is scary, but we can do this together. We can fight this together if you decide to stay at home, if you decide to wash your hands regularly, if you decide to maintain a very good hand hygiene, if you are positive and you self-isolate, if you can maintain a good social distancing, we can fight this. If you share a valuable message, information to other people who do not know, we can fight this. This too shall pass. This is not the first time the world is experiencing a pandemic. It is not the first time, and I bet you it's not going to be the last time, but this too shall pass. Do your bit and let others do their bit, and we'll leave the rest to God. He alone knows whatever that is happening. He alone knows the root of all these things, and he alone knows the end. Now the whole countries are involved. Right this morning, I was just looking at the indices, and I'm seeing that USA is going over 200,000 cases. Italy is there skyrocketing. Spain is there. Germany, UK. So many deaths. We don't know when this will end. We don't know when the peak will come. And exactly, you never know the peak. Especially if you're beautiful, you don't know the peak of your beauty until you start getting ugly. You don't know the peak of your being slim until you start getting fat. So these are facts. These are the things that may come in the coming weeks. We have to prepare ourselves. Maybe for the better, maybe for the worst. We do not really know. But from the indices, we already know what is going to be happening in the next few weeks. So it's better we prepare. We prepare. I also want to use this opportunity to send out my message to the people in Africa. Yes, you might say you are not really experiencing the hike of this. You may say you're not really having much cases. But I feel this is the opportunity you have to prepare yourself. Get isolation centers. Get more test centers. Get more hospital equipment. Get more ICUs, because definitely you'll be needing it. So we don't really know exactly how it's going to be. Nobody knows. Nobody knows when this will end. But it's better we prepare ourselves for what is coming ahead of us. It's better we'll have a positive mind to it. And if you're staying at home, there are several things you could do while you're at home. If you're not working from home, you can use this time to self-reflect on how you have lived your life. You can use this time to self-reflect on how you want to live your life after this pandemic. Like I said, this is from the clinical view. From the public health view, you know that once there is a pandemic, after effects is increased poverty. The economic crisis might increase, and then the health of several nations will deteriorate. Yes, we know the social determinants of health. We know inequality is a major cause of, is a major social determinant. Inequality amongst individuals in a community, in a country, between countries. We know that a lot of people will drop out of school. Imagine you cannot pay your bills even with 2 to 3 jobs you're doing. Think about when you don't even have one. So more cases of post-traumatic depression, more cases of more of psychological cases. More people will drop out of jobs. More companies will go bankrupt. More pupils will drop out of school. More students will drop out of school. So many people will lose their jobs. This is the fact. We are not praying for that, but it's the fact. So the earlier you start planning yourself, the earlier you start maintaining the stay-at-home policy, the better for all of us. I am stressing this not because I can predict what will happen tomorrow. No, but I'm just saying this based on the things that have happened in the past. And please stay at home. It is very necessary. It's a very common way of preventing this menace. Hand wash, hand hygiene is very important. If you must go out, get your mask. And for those of my colleagues who are really in the front line fighting this, I mean those people who see hundreds of cases on daily basis, I doff my cap for you. Those people who have put their lives on the line to save other lives, I really appreciate you. But please, while you're doing this, make do with whatever you have. I know a lot of hospitals run out of PPE. I know a lot of hospitals run out of even gloves and masks. But whatever way you can protect yourself, because we need you alive to take care of that patient. We need you alive for your family. We need you alive for us. Please share this video. Let it get to as many people as possible. Let's keep spreading this information. Let's use this opportunity to unite in love. Let's use this opportunity to unite in peace. God bless us all. Take care. Bye. See you next time. I'm still Dr. Evangel Anyanwu. Take care.